Hello, my name is Dr. Dawn Ewing. I'm the Executive Director for the International Academy of Biological Dentistry and Medicine. This is part 9 of our Biological Hygiene series, and today we are talking about MSA, Meridian Stress Assessment, the basics. EAV, which is also called electroacupuncture according to Voll, goes by several different names. Meridian Stress Assessment, MSA. It's also known as computerized electrodermal screening. It's known as electrodermal screening, various different names. It's not a biofeedback. It's actually looking at readings on specific points, and it's been around since the 1940s. You can use it to test the control measurement points. You could use it to test teeth. You could use it to test different points on the body, including allergy testing. You could use guided homotoxicology protocols. Depending on what your license is, will allow you to do different things with the same equipment. The National Institute of Health defines bioenergetics as the scientific study of interactions between living organisms and electromagnetic fields, forces, energies, currents, and charges. Bioenergetics precedes biochemistry. Here's a good example. Cut yourself. Energy in the form of messages are sent to cause reactions. The blood vessels don't constrict or clotting occur until after the energy exchange has started. A diagnosis is a measurement of a chemical change. In the body, every process begins and continues and ends with energy, not chemistry. A thermometer measures energy, but you can't diagnose a disease with that kind of information alone. The thermometer will tell you that the person has a fever or that they're too cold, but it takes more information to make the diagnosis. Healing takes place in an unconscious mode. If you had to think about healing a cut and consciously will all the steps involved in healing, then you could not walk, talk, or eat without interrupting the healing process. Bioenergetic devices measure a direct or indirect biological response to an evoked potential, which is the response of the body to energy or a change in energy. The response allows the muscles to move, food to be digested, the eyes to see, the ears to hear, and the skin to feel. All functions use energy. Every process begins with energy. There are different types of energy that we use to measure. Temperature we use to measure hot and cold. Electrical, the flow of electrons. Magnetic, we measure polarity. Electromagnetic, things like radio and light. Sound, vibrations of the air. Force, needed to move an object. Bioenergetic measuring devices, we also find them all over the place. From x-rays, CT scans, voltmeters, light meters, stethoscopes, weight scales, ohm meters, MRIs, sound meters, ECGs, EEGs, EMGs, and sphygmomanometers. Thoughts even have energy. Think of a lemon, now think of tasting it. What happened? Your saliva starts to flow. Think of a smell, like grandma's perfume. Think of a fear. Newton's law versus quantum physics. Newton's law means that the universe equals matter. Quantum law means that the universe equals energy. Your skin faces the external environment and the internal environment. It's like a receiver, like a scanner looking at the environment and all the vibrational frequencies. It also takes in information from the inside. George Ohm, in 1827, he developed a mathematical equation that described the relationship between voltage, current, and resistance. He called it conductance. The equation is known as Ohm's law. Dr. Voll was a German physician that got interested in acupuncture. He wanted to know if energy could be measured on the meridians. A friend suggested he try an ohm meter, and he found that the conductivity was better and the skin resistance lower where the points were located. In 1952, he coined the term EAV. electroacupuncture according to Vole. Vole's group consisted of about 100 doctors, all using dermatrons. The doctors would look at 180 different acupuncture points, and soon it became a diagnostic tool and is recognized in Germany as such. Where do you measure? Well, there are points on the meridians called control measurement points that give you a snapshot of how that meridian is doing. This is a lateral measurement for that side of the body. For example, the endocrine system is on the triple warmer, the CMP, which tells how the whole system is. There are points for the pineal, the adrenals, the thyroid, the parathyroid. These are summation points. These points can be found going up the meridian. Here's an example of a foot and all the control measurement points. Here's a diagram of the hand with some points. Dr. Robert Becker wrote the book The Body Electric, and he studied the currents of injury and found that the meridians flow through the mesenchyme, which was much more rapid than the CNS. The biological purpose of the meridians is to heal injury, trauma, and emotions. Dr. Tiller set out to disprove that the theory that the skin had acupuncture points that were different readings from the rest of the skin was so. And in fact, what he ended up doing was proving exactly what Dr. Foles said, that the skin did not have the same resistance. The areas where the Vole points or acupuncture points were had an area of lower resistance. He was the past president of the Material Science Department at Stanford University. The principles of EAV use acupuncture meridians in several points that are either acupuncture points or Vole points, and the use of an ohmmeter to determine the skin conductivity of electricity in the body at that point. Dr. Vole, Dr. Tiller, and Dr. Schimmer found that inflammation of an organ caused an increase of ions, which enhanced the flow of the electrons, and the resistance decreased, the conductivity increased, and that degeneration caused a decreased ion concentration that hindered the flow of electrons. The resistance increased and the conductance decreased. In 1996, the issue of the Institute of Engineers magazine had articles on acupuncture and the clinical aspects of EAV and confirmed that the technology works. If you're taking a head focus, you want to know if there's something that's going on in the head, you use a hand-to-hand measurement. If that reading is 82 to 86, that's considered normal. If it's over 86, it could be a head foci, meaning that there's a problem in the head. Here we're showing an example of taking a reading on a point for a large intestine. Here's a nerve point. Here's a point that has to do with organ degeneration. The use of a brass bar is the source of the electrons. The pointer is considered the vacuum. What should a patient remove before testing? Maybe a watch or a cell phone, anything that has a battery or some kind of magnet in it. Sometimes I prefer that crystals and diodes be removed as well. We do want to look at the spin. The spin is a natural occurrence. If you flush a toilet in this hemisphere of the world, you'll notice that the water will go in a clockwise motion, and if you do it on the opposite side of the world, let's say down in Australia, it should go in the opposite direction. If your body is in harmony with the Earth's magnetics, it will follow that true spin. And there's actually a way to measure it. We have the person touch 2 inches above their umbilicus, which is the third chakra, and we measure their large intestine control measurement point. And if it's over 60 or we see a really large drop, then we know the person is in left spin. You want to correct that if necessary, and there are some different products that are good for that. Polarity Plus, or using mistletoe 1M, which is viscomalbum. Radiation sometimes helps. Geopathic stress, these are homeopathic remedies, of course. Stellar energy or Teretastat. You want to check the other side as well, and you want to balance that side if needed. You want to educate the person as to why they are in left spin. Maybe you send them out with a Gauss meter to see if they have electrical problems in their home. Talk to them about the use of cell phones or computers or electric blankets. And maybe look at 60 cycle interference. Maybe their bed is on the opposite side of a refrigerator. The point significance is the points on the hands are really for systems and the points on the feet are more for organs. You want to wear gloves when testing because you're electrical too and your R can be picked up on testing. This is how surrogate testing works, so you want to be sure and test your patient, not you. Here's what the numbers mean. 50 is absolutely perfect. 45 to 55 is considered healthy. Over 55 can demonstrate an itis or an inflammation. Under 45 demonstrates an osis or a degeneration. The indicator drop, often called the whine. There's some need for electrons by the body in that area. Thus, the body borrows the electrons and we see a drop in the reading. How to balance a point. You want to find a substance that brings that reading on that point close to 50 without an indicator drop if possible. Best to use non-metallic chairs to test a patient. You don't want to use too much water on the skin. Sometimes big rough hands may require more pressure with the probe. You could have the patient remove their shoes and socks at the beginning of the appointment so that they're not too sweaty and let them dry out. And you don't want to allow your patient to cross their legs. Hey, I hope that introduced you to the world of Meridian stress assessment. Of course, it's not going to answer all of your questions, but the idea is that you get exposed to as many things as possible so that you go, yeah, I know a little bit about that. If you'd like to get involved, I'm just one person, so I can't teach everybody about everything. If you have a particular passion and you'd like to get involved with the IABDM and create some little videos on here, I would love to have you help me. You can email me at drdawn@drdon.net. Thanks so much.